Hello, this is Dr. Hani Abu-Farsakh. I would like to welcome you today in my clinic where we will perform the hip examination on my friend Hussam. I gained his consent to do that part on the video, but unfortunately we will not do that with full exposure as we usually do it in the clinic. But we will start now by checking his gait after just asking him to walk. I would like to tell you that I will be explaining things in Arabic and in English, so some parts you might hear me talking in Arabic. That's just to explain for him the steps that we are trying to do. Okay? During this part, I check for his gait, if there is an antalgic gait or trend impaired gait, just in case of any abnormality that can be checked. ممكن تتمدد على ظهرك. I ask him to lie down. And during this part, we can start by assessing for any leg length discrepancy. We usually try to look for any apparent leg length discrepancy while he's lying down on the couch. Usually I do that by performing the Iliadzi test, where both ankles has to be on the same level, and I try to check the knees if they are in the same level or not. And we can perform this by having the tape here and try to measure from the anterior superior iliac spine to the patella and from the anterior superior spine to the medial malleolus over both sides, and try to record these results just to check if there is any apparent discrepancies during this exam. So after that I progress towards the range of motion examination of the hips, and I start by flexion. I ask him to raise his leg up. ارفع رجلك بشكل مستقيم. Yeah, that's good, and try to record the results here. The same is here. And then we try to check for the adduction over by crossing both legs over each other and trying to do the abduction. Yeah, that's good. Extension usually will be performed when I perform the physical exam while he's on the side. During these steps, I will try to explain that again. Now I try to check for the power while he's doing this part of the exam. ممكن ترفع رجلك ضد ايدي. Yeah, that's good. هنا نفس الشيء. Yeah, that's good. And then I try to push outside while he's trying to do the adduction. ممكن انك تعمل تضم رجلك لجوا. Yeah, نفس الشيء هون. Okay, لبرا. The abduction. Yeah, that's good. Okay. I can do the Thomas test at this stage, where I try to check if there is any signs of hip contracture during the Thomas test, and trying to check over the other side if there is any signs of hip contracture. And we can perform Faber and Fader test, where this is Fader and Faber, and trying to check if there is pain over the hip or the sacroiliac joint over both sides. Yeah. Okay. Now if he's, for example, complaining from left hip pain, I start with the left hip examination by asking him to lie down on the side. ممكن انك تنام على جنبك اليمين. And during this part, I try to start doing the palpation of the hip that's causing pain for him, and I try to assess for the extension of the hip. ممكن انك تسحب رجلك لورا نشوف قد بتقدر انت تعملها لحالك. Yeah, that's good. That's the active range of motion for the hip extension, and then we can do that, of course, while we are palpating for the muscles, just to check for the power that he has over the glutes. And we perform palpation of the greater trochanter, sacroiliac joint, piriformis fossa, anterior superior iliac spine, and the hip in this part of the examination, as well as the iliotibial band down here. During this part, we can also perform the Ober test by trying to check if there is any pain over the site of the iliotibial band while we are performing that test. Okay. Now that's done, I try to assist the abduction against resistance while I'm palpating the iliotibial band. ممكن ترفع رجلك لفوق تخلينيش انزلها لتحت قاومني. ممتاز. Okay. That's the part that I try to do here, and as well I try to do adduction. ممكن ترفع لفوق. لا بالعكس نزل لتحت. Yeah, that's good. That's for the adduction. After that, I can ask him to lie down again on his back and coming down to the standing position. During the standing position, we can test for trending back test. I ask him to stand on one of his legs توقف على رجلك اليمين and ايديك على جنبك. Yeah, the hands on the sides and trying to assist for the shoulders movement. And then we do that again on the left side. على الجهة الثانية. Trying to look for compensation of the weakness of the glutes. Yeah, that's good. Okay. After that, we do the squatting just to check for the strength of the muscles while he's doing squatting. ممكن انك تعمل ارفص لا ارفص. أيوة وقف. Okay. Fine. Then I will ask him to do the single leg squatting. ممكن هيك. وقف عليها. Okay, that's the single leg hook, and then we can do the single squatting. Okay. Yeah, that's good. Okay. After that, I usually ask them to walk, and I try to notice if that induced any kind of pain by my physical exam that might be causing an antalgic gait after performing the exam. Of course, the steps that I did on the lateral position has to be done on the other side, but for the sake of quickness, I will try to skip that for now. ممكن ترجع مكانك. By that, I can conclude my physical exam. Thank you very much.